So one of the really exciting new technologies that's developed in cardiac care in the past decade has been the ability to replace a valve over a wire. This is called a transcatheter approach to valve replacement, or transcatheter aortic valve replacement. Those letters come up to TAVR or TAVR. This idea started about 10 or 12 years ago with some people wondering whether we could put a valve inside of a stent, pass that stent inside of a diseased valve, and then blow that stent up, letting the new valve begin to work inside and pushing the diseased valve out to the outside. It seemed like a difficult concept to get to reality, but the truth is that it works. And there's been a lot of work done in the United States and in Europe on developing this technology. So transcatheter valve replacement is a reasonable option for people who are at elevated risk for traditional heart surgery. So typically these people might be a little bit older, might have had previous heart surgery, might have lung or kidney disease, things that would make us think that they might have a difficult time with the standard valve replacement option. For those people, the studies have shown that this is an excellent option. This valve is put in through one of two ways. In some patients, we're able to thread it up from the artery in the groin and reach the artery near the heart and actually pass this through the narrowed aortic valve and blow it up. In other people, it's just too big for the arteries in the groin or pelvis, and in those cases we make a small incision between the ribs just below the left nipple and reach the heart that way and pass the valve directly through the point of the heart. So one of the exciting developments at the center has been starting this program and having real great success with it. So I think it's an important piece of trying to offer the widest range of possible options to our patients. I think people who are having transcatheter aortic valve replacement represent a very high-risk group of people who often have a lot of additional medical issues. One of the reasons I think that we do a good job with those patients is because we approach each patient individually. We try to really understand the nuances of their medical history, and then we spend a lot of time discussing it amongst ourselves, and we go the extra step of really having detailed conferences where we review the information. I think the more people looking at these complex patients, the better, in terms of not letting anything pass through or giving different perspectives from their different specialties. So a real patient-centric approach with a team behind it is what I think makes our program special. And so I would encourage people who have that disease, and even if they've been told maybe they're too sick to have heart surgery, to consider getting evaluated for transcatheter valve replacement.